Are we ready to start?
I think they are still waiting for other doctors to join. Am I right, Dr.
Okay.
Hisham?
JB ini siapa lagi join ni? Emran ada?
Emang tak ada.
Tak ada. It is involve Sky Hill and Wellet only kan?
Can you repeat again?
Is it involve Sky Hill Clinic and Wellet only?
Yeah, only these two.
Okay.
So if can start, then you inform me.
Clarify. Maybe we can start because relatively in yeah.
Okay. Then I'll share my screen and let you all have the look on one of the patients called Mr. Azhar. Okay, we will look at Mr. Azhar report and then I will walk you through on every aspect that have been reported. Okay, can you all see my screen?
Yes.
Good. So this one is the epigenetic age clock test report for Mr. Azhar, and then this one is the one of the most important and also the basic report, which is the telomere length report lah. So in here, this will be the results that have been shown. Here have reported about the average telomere length, which is 7 kb, and then here have the chronological age of Mr. Azhar, which is 41.82, close to 42 years old. And then we also have another part here which shows that what is the current telomere length of Mr. Azhar. So we can see there is a comparison. Chronological age is the age of birth for Mr. Azhar from the time he born until now, which is a chronological age. So here we also have the predicted telomere age. So this predicted telomere age is based on all the different aspects that have been covered in this test, because in the epigenetic age clock test, we not just only find out the telomere length, but also other things such as the immune functions, because they will use all this information in order to come up with a final predicted telomere age. So currently the estimated telomere age based on all the findings will be 53.92. which is quite higher compared to the chronological age of 41.82 lah. So this is just an estimation. So it's like the result will be almost around this range, either 52 or 53 lah. But since 53.92, so the result should be around 53 to 54 each. So here have a basic introduction of telomeres, telling you what is the definition of telomere. Basically, they are the caps at the chromosome, at the end of the chromosome. So as the cap is getting shorter, then this means that there will be more diseases will occur. So our purpose of doing this test is to check the current biological age and also the chronological age, so that we know that whether the aging is too fast or too slow lah. So other than that, this will be some of the references is provided. So basically, this is what the telomere age report will tell you. So now we go to another report. This one is the Dundee pace report, and in here this is a summary. It will show you the Dundee pace value and also how to interpret it. So in order to interpret this report, we need to see that here have mentions you want your rate of aging to be below 1. So if anything more than 1, this means that you are aging much more faster compared to your chronological age. So the fastest rate of aging has been 1.4 biological years compared to 1.0 year of chronological age. So that's why you see here the maximum is 1.4 and the slowest rate of aging is 0.6. So the good result here will be anything below than 1. So in here, the result of this client is 0.97, which is already close to 1, but still considered to be below. So it's a good result. And then here also got mentioned the average person will be age ranging from 1.0 biological age compared to 1.0. This is the normal range lah, right? If anything's below 1 is considered to be good. Anything more than 1, that means that you are aging too fast. So here also got mentioned, dietary intervention like fasting has been shown to decrease the aging rate. So if the patients want to achieve a much more better result in the Dundee pace value, then you can advise them what kind of foods they need to prevent, what kind of diets they need to adopt in order to have a better result. Okay, so here is some of the definitions for the aging rate and also body biological age. Here is some of the informations like this one is the pace of aging value which we already discussed 0.97. Okay, so based on this result, it means that within 7 years from testing, those with a faster pace of aging will have a 56% increased risk of death and also 54% increased risk of diagnosis with a chronic disease. So this one is based on the research based on the researcher and also the lab informations. They noticed that if people they are aging faster, that means that they will have a higher chance of getting the chronic disease. Okay, so here will also be some of the definition and information based on how to show you that how accurate and also how comprehensive is this Dundee pace testing. And then this is some of the steps. What is the step they use in order to get this final result? Okay, so basically this is what this test report mentioned. So after this, we can go to another report, which is the CPG lossy report. So this one is finding out the weight loss response to calorie restriction. So here we mentions how difficult or how easy is the patient's if he want to lose weight. So here I have give some simple definition about what is obesity, and then based on this report, we also will be able to get some of the information about how easy and also how difficult for this patient to lose weight. So here we will have a CPG beta values, and then based on this value, we have a two response status, either hypomethylated or hypermethylated. So this hypo and also hypermethylated, they have two different definition, as you can see here. For non-responder, CPG lossy around your PON3 gene are generally undermethylated. Your response to caloric restriction alone is low. So if the caloric restriction alone is very low, that means it will be not very difficult for the patients in order to lose weight. That's why here mentioned not likely to be the most effective form of weight loss. So the most easiest or most effective form of weight loss for patients is depend on whether they are doing the exercise or not. I think there's some disturbance. Let me mute someone. Oh, it's doctor. I need to mute him first because there's some noise there. Okay. So just now I saw Marlinda's asked, sorry, which slide? This one is the weight loss report. CPG weight loss report. So here have a three possible outcome. Just now I already mentioned non-responder. Now is the intermediate responder. For CPG loci around your PON3 gene are in the normal range using.
I don't think your report is moving for me. I think you're stuck on the page.
Okay, let me reopen it. Okay, can you see the CPG loci report here? Okay, this is just now the things that I will mention, the possible outcome for the CPG beta values. So there is a three outcome. So anything that is a red color hypomethylated is not considered to be a good result. So we need to analyze what would be the most effective way in order to help the patient to lose their weight. So there is a 3 result. If a hypermethylated, this one green color is good, which is already mentioned in here, and anything that is not good is the hypomethylated. Here means that hypomethylated means that the response to caloric restriction alone is low. That means in order to lose weight, the patients not only need to control their diet, but also need to do other things like exercise. For hypermethylated means that their genes are more effective if you use a lose weight method of controlling their diet. Okay, so this is basically what this test tell you.
Can we change that? You see that it's hypomethylated everything. Can we improve it? I mean, can it be changed? Or it's permanent like this?
Yeah. For this kind of things, right, in order to change, it will be you need to advise the patients to also do other things, not only on caloric restriction, but also on helping the patients to find out what kind of lifestyle they are currently using, because our lifestyle will also causes this issue lah. Like for example, some people maybe they are also smoking while they are losing their weight, while they are controlling their diet, so the lose weight rate will not be so good if they have a hypomethylated gene. But if they have a hypermethylated genes, then it will be very useful for them. Maybe they only need to control their caloric, then they will be able to lose their weight. But if they are hypomethylated, that means they need to do more work lah.
Well, in addition, you can also increase the methylation, right? There are certain supplements you can take to increase the methylation. Especially if we like compare this report with our methylation profile and see whether the genes, which pathway it is that is under methylated, then we can also do something to upregulate the methylation.
Yeah. So
that means if you do some intervention and we check again, does this hypomethylated area, is it changed or it's maintained like that also?
It will be changed if you are able to do some intervention. So we will recommend the patients to redo the test after 3 months of intervention. Okay, so if no other questions, then we go to the next part, which is the immune report. So this report will also give you information on the immune cells of the patients, whether it is effective in order to deal with age-related decline of the immune response. So here I have mentioned this is some of the type of the immune cell. And then if we are aging, that means whether their functions will become lower, whether their amount will become less, and also whether their effectiveness in dealing with the disease or disorder of the patients will reduce or not. So here is the result for the immune cell. So in here we can see this is in the left side, the immune cell type. This is all the different type of immune cell everyone also have. And then here we also have the result, your percentage, which is like, for example, 2.23%, 0.0%. So in here, for the rule of thumbs is if the patients have an immune cell amount that is too low, then it will mention lower than anticipated in the most right position here. So if anything higher, that means good. Anything low, that means it's not good. So in order to find out whether the patients have a good amount of ratio in order to deal with the disorders, they need to have a higher level of immune cell in their body. So anything lower will consider to be problem lah. So for these patients, I have calculated you will have around 9 lower and also 3 higher result. So that means that the immune cells that currently he have is not very sufficient in order for him to deal with disease lah. If in the future when he's continue to age, when he have a lot of a severe disorder, his body immune cell might not be able to deal with them. So the next part here we see the CD4 and also CD8 T cell ratio. So this T cell ratio is very informative in order to give you information about the disease of the patient might have. And a value of 1 and 4 is considered to be ideal. Anything that is lower or higher than 1 or 4 will mean that the patient are very susceptible to have a disease, and that means they also have a immune risk phenotype, which means that they are associated with altered immune function, and then they will have a chronic inflammation in their body. So in here we see here the result, which is a CD4 or CD8 T cell ratio. Currently the reference range is 1.0 and also 4.0. And for this patient result, the ratio is 0.37, which is already out of the range. That means that's why you see on the right side, is it higher or lower than anticipated? The result is lower. So based on this result, right, it means that the patient might have a chronic inflammation in his body, and then you can advise the patients in order to do some autoimmune tests to check whether his body having any problems in immune function, and also can advise them to do some tests in order to check which part of the body have a chronic inflammation. Can be guts, can be any organ. And then other than that, we can also see that the regulatory T cells to total T lymphocyte, the number second, this is also another ratio that is very important, because anything that is out of the ratio of 1.0 to 4.00 means that the patient have a susceptibility to have cardiovascular disease. So currently the result for this patient is 0.44. This means that he might have an issue there. So you can also recommend them to do the cardiovascular test to check the LDL subfraction, which our lab have provided. Because traditionally a lot of the labs, they only provide LDL, HDL tests and also the cholesterol test. So a lot of practitioners, they will check whether the patient have a high cholesterol. But actually cholesterol is not the main indicator of whether the patient have a cardiovascular disease. But actually it's the LDL subfraction for the patient.
Can you repeat again?
Just now,
Regulatory T cell.
regulatory T cell, this one, the second one. Regulatory T cell to total T lymphocyte. So this is a marker to tell you whether the patient have a higher chance of getting cardiovascular disease. So anything that is out of the reference range of 1 to 4, this means the patient will have high chance of getting it. So currently the result for this patient is 0.44. So we will recommend the patients to do some cardiovascular tests in order to check whether he have any disease risk. So currently we have the LDL subfraction test, which you can recommend your patient to do in order to find out the size of their LDL subfraction, because usually those small and dense LDL subfractions will cause the cardiovascular disease compared to the large and also buoyant size of the LDL. Okay, so here we also have another ratio. This one is talking about the NLR. So these markers will give you information on the neutrophil to lymphocyte ratio, which reflect the amount of the physiologic stress. Basically, it's like a stress test, tell you the current stress level of the patient is high or not. So currently in the current result, it shows that the value of the patient is 5.11, which is is a bit higher than the normal range, and the severe stress is any ratio, any result that is more than 18. So we can use the normative ratio, the NLR stress ohmmeter, in order to do the comparison between the value. So in here we also have see that if the patient have an increased level of cortisol, then this will causes their NLR result to go out. So if anything more than 3, that means the patient might have a high stress, and then you can also recommend them to do some stress hormone tests. Because if stress level too high, it will also cause the patients to age much more faster than their current chronological age. So this is also
we will recommend the cortisol awakening response test. That would be a very good one to look at the fluctuation of cortisol throughout the day.
Yeah, the cortisol awakening response test will be one of the best things that you can recommend for the patients to check whether there is any fluctuations in the stress hormone level. Okay, so next one, monocyte to lymphocyte. This is still within 1.0 to 4.0, so not much issues there. Next one we see here is the immune cells in the blood law for the patient. Because all these different immune cell level can also tell you whether the patient have a higher chances of getting any disease. So here we'll have the result in terms of age, BMI, alcohol, and also exercise. And then what is the function of all these different immune cell? So like for example, if people that have a better sleep, this means their natural killer cell level will increase. If they are smoking, their natural killer cell will reduce. So this natural killer cell function is basically to help your body to kill any cancer cell and also any cell that will causes disease in your body. So it's quite a very important cell in our body lah. So in here, this is a chart to tell you what kind of behaviors that the patient do will affect the amount of their natural killer cell. Okay, so this is also a very easy chart to help the patient to understand what is the lifestyle that they do and will have effects on their cell type. Okay, basically this is this immune function report giving the information for you. So inside this report,
go to that this below. Lagi
Sama.
lagi atas lagi. Start. This age what did this means? Age. Aging, is it? Or what?
yeah, aging. So this is like a chart that gives you information which one is the factor which are associated with higher level of naive CD4 cell, memory CD4 cell. So all this is a immune cell type, the different type of immune cell. You can go to the first different page in order to find out what is their definition, what is the function of each of these cell. So this is like giving you information to advise a patient. What is the things that they can do in order to increase certain immune cell type? What is the factor in their lifestyle that will decrease the level?
So the contribution to the epigenetic clock lah. Age means, yeah.
Okay, any other question?
Excuse me, I got a question here. Am I audible?
Yeah.
Yes.
Okay, you mentioned earlier CD48 ratio is between 1:4. How do you differentiate the ratio if mine is less than 1 and somebody is more than 4? How is it different? When both are not normal.
Can you repeat again?
You can see the range is 1 to 4. Less than 1 or more than 4. You mean not normal, is it?
Yeah, anything that is out of the ratio means that you have problems in your body lah. Like for example, chronic inflammations. Your immune cell might not be able to effectively deal with all the cancer or also infectious cell. So,
Yeah, exactly. My question is, if a couple comes, the wife is less than 1 and the husband is more than 4. So what's the difference between these two when those two are not normal?
okay, so if you see here, it mentions that a low or inverted CD4 or CD8 ratio is an immune risk phenotype and is associated with altered immune function, immune senescence, and chronic inflammation in the first paragraph. So this is for the indication of low CD4 or CD8 ratio. If higher than that, we also have an indication which is on the last paragraph, a value of 4 plus marks, hyperactivity or possible infection, autoimmunity, or additional immune risk phenotype. So this is like giving you information like if too low, what will happen? Too high, what will happen? Did I answer your question?
Sorry, I'm not very clear.
Okay. So for anything that is out of the range of 1.0, like for example, too low, lower than 1.0, this means the patient have a maybe have chronic inflammation in their body, and also immune senescence problem. This means that their immune function may not be able to deal with the disorders, the problems, and also any disease that come to their body. Anything that is higher than 4 plus, this means they may have a possible infection, autoimmune disease, and also higher risk of getting any autoimmune disorder.
Okay, get it clear. Thank you.
Okay. Any other questions regarding this report?
Carry on then, Tommy.
Okay. Then we go to the next part. Okay, let's see. Mitotic. This one is the mitotic clock report. So in here, the mitotic clock report will also give you some information regarding the total stem cell division in the body. So here we can see that the stem cell division have also related to the cancer risk of the patient. There's an intrinsic process and also extrinsic factors that will affect the stem cell division. And then this is a formula on how to get the stem cell divisions ratio. So here is the result of the patients. Your cumulative number of stem cell division per stem cell per year. So in here we can see that the result is 1205.10 for this patient. So based on the result, you will be in the 33.22nd percentile of cell division compared to others of your same chronological age. And then below, we also can see that your average estimate for the intrinsic rate of stem cell for the tissue is 28.82. So based on this result, this will give you an indication of how well the stem cell division for the patient. So anything that is more than the average should be considered healthy. Anything less than that means that you have a higher risk of getting cancer. Okay, so here will also give you an idea. What does that mean for you based on just now the result? So it's important to know that the report does not detect cancer because this is not like a cancer screening test. But any patients that have anything that is not within the optimal range, then we will encourage you to let the patients to do some cancer screening tests.
What is the average of the result? At least berapa?
Average mean what?
Average,
So in here, right, anything that is above the graph, then only is considered to be healthy. So as you can see, I make it bigger. For these patients, in the chart, you can see that the green color is already lower than the blue line, which is the average. That means it's not within the healthy range. Within healthy range should be in the middle, or should be in the middle or a bit higher. This one also lost the second one. So it's like perform under the average.
Can we say above 50th centile is average? Can we say that?
Yeah, can say that.
Well, average is precisely 50 percentile. So above will be above average already.
What's the meaning of intrinsic rate? Extrinsic rate.
Intrinsic.
Okay, so intrinsic is like anything that is based on the cell, based on your own body, and extrinsic is like things that is a factor because of your lifestyle. So it's basically like lifestyles. Maybe some people they will drink, they will smoke, then this will causes their extrinsic to have problem. Intrinsic is like your own body, your gene, anything that is related to your own self. Yeah, this is the difference.
So for this patient, the problem is from intrinsic factor, not extrinsic. Is it?
Yeah, the below one is related to the intrinsic.
Dia tak ukur pun yang extrinsic, tak nak ukur sebab luar kan. So dia ambil kita punya ni sekarang check yang intrinsic pula.
Dalam
Dia macam nak ukur yang extrinsic.
Continue.
Okay, can continue.
Okay, understood. Then
Yeah.
go to the next one. Okay, this one already covered. This one also. This one is also another inflammation reports. So this one is also a very important things to find out whether there is any inflammations that will cause the brain to have a dementia or neurodegenerative disease. So we see here, this is the result of the patient. You can see the DNA MCRP level of the patients, whether it's too high or too low. So here we can see that the result for the patient is 99.77%. And then I think this chart maybe is a bit too okay, you can see like this. So DNA CRP is something that is produced in our liver in response to any acute inflammation, and it has an inverse relationship with cognitive function such as memory, speed, and visual spatial function. So that means that if this DNA CRP is already too high, this will also causes problems in the memory, speed, and also visual spatial function. That's why they have an inverse relationship. One is too high, another thing will go down. So currently, the patient DNA IL, this IL stands for interleukin. Interleukin 6 level is higher than 95.50% of the population at your same calendar age and sex. So based on this result, this means that the patient might have a higher risk of getting problems in their body like inflammation, and also they might have an issue if they continue to smoke, if they have alcohol intake. Because this one is a DNA MIL6 is positively related to all these different disorders. So if the patient's this DNA IL6 is too high, you need to help them to reduce their any things that they do in their life that causes this level to go up.
For this caption is inflamed, this report shows.
Yeah, it's showing you the risk.
There's a question about extrinsic chart, Tommy.
Oh, let me check. There is no extrinsic chart here. Does it mean that no external factors will influence his cancer-related factors?
I think there's an extrinsic score, right?
Yeah, there is an extrinsic score. The top one will be the extrinsic score for just now, that one. For the below is the intrinsic.
Yeah, then move back up to show.
This one. The bottom one is the intrinsic lifetime intrinsic rate.
Bottom intrinsic.
So the top one is more the extrinsic one.
Oh.
So both are also low, basically.
Yeah. Both is also below the average. Okay. So this is the result for the CRP and also the interleukin 6. So here I will also give you some of the information on the CRP on the definition. Okay, so this one can read. Basically, they are also giving you information on whether the liver are able to produce sufficient CRP, and also whether the interleukin 6 of the body is too high. If it's too high, then you need to recommend the patients to do some changes in their lifestyle. So as you can see in the result, basically the CRP is already higher than the average lane, which is the blue line. And then for the interleukin 6 is also too high.
So better below the line.
Yeah, better below the line for this one.
So for the DNA IL6 to reduce it, we have to correct some other BMI, self-reported smoking status, or alcohol intake. These three only.
Yeah. If the patient have this kind of lifestyle, then you need to advise them to reduce the rate or totally eliminate no smoking, no drinking alcohol. If not, this result will still stay very high. So you can help the patients to do some intervention. After 3 months, we do the test to see whether the result become better.
For this question, Azhar, his BMI is okay, not smoking, and also not taking alcohol. So what are other reasons for the high IL6?
Well, there are many factors that increase inflammation,
I see.
right? Yeah, I mean, like for example, your intake of oil, right? Yeah, too much omega-6, that would be inflammatory. You know, just now we mentioned about cortisol, that is inflammatory as well. Yeah, there are many factors.
Or not only these three factor only.
These are the lifestyle factors lah.
Okay.
Yeah. Mm.
Yeah, not only these three factors, but there are also other factors that were related to it. Only these three is the most positively associated. So if the patients don't have all these issues, then you need to help them to check whether they have any other lifestyle factor like diets that will cause them to have this issue, and also whether they exercise, have a healthy lifestyle or not.
Yeah, Lab has like the omega-6, omega-3 ratio test, for example, to look at inflammation, you know, caused by imbalance ratio.
Infection also can cause allergies. Right?
Allergy, yeah, allergy can also cause inflammation. You can do a food allergy test. Yeah. Mm.
Okay, any other questions related to this report?
Okay, can you continue? Okay, can you continue?
Let me check which one we haven't covered. I think mostly already all covered here. This one. Next one we see here is the triglyceride and diabetes risk methylation report. So in here, this is the reports that will give you information on how high in terms of the risk for the patient to develop a type 2 diabetes. So you can see here, this is the result for the patient. And then this will give you information in the ABCG1. So this is like a genes that encode member of ATP binding cassette protein family, and it's also play a role in the homeostasis of the glucose and also the lipids. So for this patient, currently the epithet value of him is 0.63, and then the risk is if anything that is within 0 to 0.7, this means there is no increased risk. So if the patient have anything more than 0.7, this means that he will have a higher risk of getting type 2 diabetes. So here we also have another thing called the PHO-SPH01, which is a photophase test that will play an important role in the skeletal muscle and also for cardiovascular health. So in here we can see that the result for the patient is a 0.11, and then this result according to here is no increased risk because the range is within 0.05 to 0.1, to 1. So anything that is above 1 only means that the patient have a higher risk of getting the diabetes and also might have some cardiovascular risk disease. Anything that is below, that is within the range of 0.05 to 1, that means no increased risk there. So basically on these two different average DNA methylation score, the patients don't have high risk of getting diabetes too. So here is a calculation, give you the information on how they get this result, and also the impact to you, to the patient. So here we have summary and also some reference.
This result also can be changed, right? I mean,
yeah, can be changed based on the lifestyle changes. Yeah.
Everything can be changed. That's the value of doing these tests, right? To monitor any treatment and the progress. Anything else, Tommy?
Okay, next one. I think this one already covered.
If patient have already changed their lifestyle, when they have to check again,
Around 3 months.
3 months, okay.
Yeah.
Okay. Any other question?
So the true age ratio is what, 0.97, is it?
Yeah, 0.97.
Okay.
Are we going to compare with Nozilla to get more understanding?
Compare. So actually, if you already have all these informations, you can also do the comparison to see which one is better lah.
But we can have a quick share of her report lah, right? We don't have to go through, but just a range.
Okay, so this one is for the Nozilla one. This one is the Dundee pace report. So in here, the Dundee pace value for her is a 0.99. It's also close to 1. So if you want to compare with just now Mr. Asa one, I think his Dundee pace value is much more better because it's 0.97. It's better for 0.02 if you compare. Okay, so other than that, in here, this one is the telomere length report. Currently, chronological age is 57.72, and based on the estimated telomere age should be 51.12. So this one is like a much more better result in terms of the comparison for the telomere length, because you can see chronological age is 57.72, but the estimated telomere age is even lower than the chronological age. So anything that is lower than chronological age is considered to be best lah. If anything higher, that means the patient is aging quite fast. So that is the comparison for the basic reports. And let's see in terms of the mitotic clock. So in the mitotic clock reports, we can see for the two results, the extrinsic and also the intrinsic one. For the top one, you can see is on the middle already, in the middle of the blue line. So this one is a good result. And also for the bottom one is also in the middle. So this is also much more better than Mr. Asa one, is already below average. Okay, so let's do a comparison in the immune cell report. Okay, in terms of immune cell reports, we can see here the NLR. For the NLR of the Nozilla report is a 4.0, 4.10. 4.10 is also slightly higher than normal, so can also recommend her to do the stress test, the cortisol awakening response test, in order to check the stress level, because it's already higher than 3. So other than that, in the CD4 and also CD8 ratio, here is the ratio for Nozilla is 0.50. This one is also out of the range, out of the range of 1 to 4. So it's lower than anticipated. Other ratio, other value is also not within 1 to 4. So you can recommend her to do also cardiovascular test to check the current LDL subfraction level. Okay. Next one, we see the cognitive inflammation. So in terms of cognitive inflammation, like the CRP and also the interleukin-6, this is also higher than the average. 48. 88.63, 88.40 compared to the population at the same age and also gender. So also need to help the patients to identify whether her lifestyle causes this IL-6 and also the CRP to be too high. Maybe she doesn't smoke, maybe she doesn't drink alcohol, but there's other aspect in her life that will cause this. Okay, in terms of the weight loss report, what we can see here is her CpG beta value, mostly is a green color one, hypermethylated. Only two, which is number 4 and number 5 is hypomethylated. Mostly is green color. So any caloric deficit diets, restriction in a certain foods diets will be able to help her to have a much more better effects in reducing the rate of aging. Okay, next one we see is the diabetes risk. So in here, the diabetes risk for the first one, the ABCG1 gene currently is 0.60. This is still within the range, not more than 0.7. And then here, the next one we see is the PHOS, PHO1. This one is 0.12, also within range. So also no increased risk in getting the type 2 diabetes. Okay. I think, yeah, that's all. Any other question?
So it's interesting that there are some aspects that she performed better than a male patient, but overall she did worse right? It's 0.99 compared to him. So you can look at specific components of methylation, to intervene. So this is the value of the report, right? So give you very customized information for intervention, not just the overall results.
I have a question. If we look at the DNA, CRP, the inflammation part, we are comparing the result based on population. How do we know that if the number is less than 50th centile, it's better? I mean, we
No.
don't.
So this is just average comparison. It doesn't
Yeah.
mean it is healthy, right? Yeah, it's not necessarily optimum. It's just what is average out there for sure. If most of the population is not healthy, then then even though you're under, it doesn't mean you're healthy, right? That is true. Yeah.
So we don't really have the exact level for healthy person.
Right, based on population comparison, but then all the subcomponent of the reference range, those are the healthy range, right? That you can have.
Any other question? No question.
Can we have your consent to so this video is recorded? Can we have a consent to share with other doctors for learning purpose or not?
And
10, all right, thank you. Yes, I think good education for other doctors too.
JB, Dr. Malinda, Dr. Faiza, no question, Teman, no question,
Great. If you have any question in the future, of course, you can reach out to us.
Sure.
Thank you. Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye.
Bye.